So I had sent you, if you got a chance to listen, maybe you didn't. I used this PowerPoint, and there are two that I use. The Welsh Hole one, which is your textbook one, I don't love a lot of the illustrations. The initial part was what I recorded from. I got to about here when we start really looking at the bone structure. Maybe you had it before, but you have to understand it my way. The next exam I sent you the study guide for, because I know inevitably someone's going to ask me. I've seen this movie before. It's okay. You try watching as old people, two screaming grandchildren. Hey, mom and dad aren't there Saturday night. We don't drink, but if that would have been an excuse. So effectively, it's good, but I sent you that as basically it's going to be the cell bones. Whether there's going to be any joint information. You probably had a fair amount of this. I would anticipate, knowing Dr. Robbins, he hit this stuff. Did you talk about this kind of structure? You know, the lamellae, interesting. No. Gotcha. This is where we're going. We're doing bone. I love bone. If anything, I'm qualified to teach you guys about bone. They don't let you operate on bones unless you know something about bone. And thankfully, they haven't changed. I haven't operated on one in 25 years. I have no intention of doing so, since I no longer maintain my license to do so. Moving on. But I just sent you these. This is, I think it's a little bit more, from my standpoint, I think it's a little easier to see and to understand. I mean, a lot of the illustrations are the same. You can see something like this and talking about flat bones, which are basically, and that's like the bones in the skull. This is a very good example of trabecular patterns. They'll show you osteoporosis, looking at the same kind of an image, and you'll see the distinction between osteoporotic bone and this. And that's important. Understanding what goes wrong with bone, not just breaking bones, but the bone diseases. If you're going into healthcare, who needs healthcare the most? Old people. And 85% of them have some degree of osteoporosis. They just do. Can't avoid it. It comes to the territory. Father Time is undefeated. So that you'll see that. But my thrust is to make you understand to some extent what's going on. Here's a typical lung. If you didn't recognize it, it's humerus. They have it here. Any long bone, longer than they're wide. To understand how bone elongates, to understand how bone repairs itself, what's so darn strong about bone, this is where we start. I'm hoping by the end of the week to have the next test date. I'm going to try to get it in tentatively the 29th. What's today? 6th. I mean, it's plenty of time. That's why I said I want to get it so you'll get an idea, know your grade before that drop dead date, if indeed you have to drop it. I'll do anything I can to help you. That's my job. It should get easier. When this is week 7, so you have next week is week 8, and lab's done, correct? I saw the smile. That means I should be your person of interest. Give the phrase, usually looking for a criminal. How about Mark Sanchez? Football announcer. Did you see all that? Oh my God. Bar fight. I mean, look it up. And I just listened to him. I thought he was really doing a good job broadcasting. Oh my goodness. When the Steelers last went to the Super Bowl, the last 2 times they beat the Jets consecutive years here at home in the game and in the AFC Championship. He was the quarterback. It was his first 2 years with the Jets. And then his whole career went downhill. All these high-profile Hollywood dating all these starlets and stuff like that. Wow. Okay. A little bit of a problem with the booze, I think. Nevertheless, here we are. This is really important stuff. Okay. The idea is the strength of the bone is in the cortex, that thick outer rim. You're think of a hollow for now. like a metal tube. And the stronger that metal tube, it's not thin, bendable, like maybe an aluminum thing you're putting up, like thick tent poles, okay, thick awning poles. And the thicker they are, even though they have an opening in the middle, that's the cortical bone. We call it cortical or compact bone because you'll see the way of packaging. Understanding that packaging gives you an idea not only of the strength, but even the ability to twist and resist breaking with twisting. This is the marrow cavity. They have it with that yellow thing in there. All of us effectively have now, the red bone marrow has pretty much converted in all of our long bones with some limited exceptions. Okay, like the head of the humerus, so to speak, would be a limited exception. You might have some red bone marrow up there. Effectively have gotten this yellow bone marrow, which is, and they erroneously say, oh, that's for fat storage. It's not. I mean, and under high stress, it can even convert back to red bone marrow when there's a lot of stress needed for blood production. Someone would be very, very ill for that to happen. But in growing bone, it's red bone marrow. And all of those wonderful little nooks and crannies I showed you before are draped with what we call hematopoietic tissue. That's where effectively our bone cells start. Technically, they're in the bone. They're not necessarily part of the bone. What they're draped within here, covering all of these areas. And as we move on, covering the interior here, and even along all the perimeter, I'm going to get to the periosteum, which is what this is in just a second. That's the tissue that surrounds this wonderful, and membrane's not strong enough for it, this strong sheath that's very membranous on the inside that adheres so firmly to bone. It's where all of the bone healing cells come from. It's where the bone really is remodeled, and your bones are remodeling constantly. You don't have your original bones times two. Everybody sitting in here, your bones have all been replaced twice. They're constantly remodeled. So why was born with these? No, you weren't. Understand, that's the beauty of bone. It has this magnificent blood supply. If you just get the pieces in close proximity and hold them there, it heals. Now, whether or not it's going to be functionally useful, that's a different story entirely when we start, dealing with the severity of some of these injuries that you see so early now in football season. So we're going to look at these areas. So the epiphyses, proximal and distal, the head and tail, head and base, whatever you want to call it. Okay. And I'm not doing the anatomical terminology. You don't have to know that this is the trochlea and this is the capitulum. Yeah, I took that course. Okay. This is cancellous bone, spongy bone, a bit more forgiving. Cartilage lines the end because it comes from a cartilaginous shell. It's called enchondral or endochondral bone. The vast majority of our bones, effectively all of our appendicular bones, okay, or appendages and the connectors, the shoulder assembly, the hip assembly, pretty much came off from cartilaginous shells. Not entirely, but the long bones certainly did so. And the cartilage that's left is here and here. And effectively what happens when blood invades is called the nutrient foramen, where the blood enters. That's something in advance we learned very much about when we're doing surgery to avoid hurting it because of the major blood supply. Effectively, when blood starts to invade the cartilage, magically blood is poisonous to cartilage. Probably the wrong term. Destroys cartilage and effectively accelerates its replacement by bone. That's kind of what happens. All that's left is the part that's smooth, white, and glistening in joints. They demonstrated here. When we're talking about endosteum, this is fine lining. This is called trabecular bone. This is cancellous or spongy bone. The cortical bone, particularly if you're getting close to the joint, is very, very thin. Comparatively, where the strength comes from is the shaft of those bones. More so for weight-bearing bones in the lower extremity, more so for the dominant bone. More so if you're in a job like many of you are going to be, standing on your feet all day. Less so for somebody like me who's not standing on their feet, sitting on their posterior. Moving on. So the periosteum, strong, outer, very, very strong, dense, irregular connective tissue, like deep dermis. Then you have this layer of cells. These, when they call osteoprogenitor, it's a big name. It just means cells that can almost become any kind of a bone cell that are there. And again, since it gives rise to all of the bone cells, That's the part when you break a bone where healing comes from. We're so careful. I pointed it out in the other, and I'm reiterating the previous presentation. It's so important because that's where the healing comes. That's the part that hurts. Bones don't really have anything in the way of pain fibers on the inside. It's often that periosteum. We cut into it, we preserve it, we sew it back together. Okay, these perforating fibers, bundles of collagen, we know how strong that is, into the bone itself, secures the periosteum and its anchors for tendons and ligaments. Time for a surgical anecdote. You have to announce what you're going to do. I did a procedure with an orthopedic surgeon in the hospital here. It used to be called Central Medical, and it's where the hockey arena is now. They bought it and made the arena out of that. Nevertheless, he and I did a case. They had a bone in the foot, had been born in like two pieces and was creating problems with the foot. I had never done this procedure. I basically had to remove that extra piece of bone where the big tendon was attached and reseat it. Same kind of thing you would do for an Achilles tendon if you had to reseat it, except this was a posterior tibial tendon. And how strong is normally? We detached it, removed the piece of bone. In order to get the same degree of strength, it's a thing called a MyTac. It's like a polyethylene plug that you would drilled a hole in the bone, stuck the plug in. The plug was like twisted it. And out came like little grappling hooks, like little fish hooks made of stainless steel, and pulled back on them to anchor them in the bone. Sticking out of the end that protruded were like shoelaces made of suture material. And then we like reefed them. In other words, crisscrossed them like to be lacing up a pair of hockey skates or figure skates. That's how strong it is to replace what they call these perforating fibers. Another name for them is Sharpey's fibers, capital SHARPEY apostrophe S. Okay. That's how strong that stuff is for anchoring points for tank. It is not easy to do. Okay. We managed to get that done in about a half an hour or 40 minutes, but it is. And I'd never done one. Thank goodness this orthopod was really very good. And here's the endosteum, and it contains the same ones. It's really not quite as active. Tons of blood supply. To understand just the nutrient frame is where the blood entered and entered first. It's a major blood supply. Got to be very careful about it. Don't want to hurt it. Okay, and into the epiphyses, the tops and bottoms, the ends, you have a separate blood supply. All of this understanding, particularly if you're going into a field, and a lot of students want to go into physical therapy fields, occupational therapy fields. If you do any nursing with orthopedics, any of that stuff, okay, this becomes very, very relevant. So I'm trying to give you an idea of the relevance. This is how, when these blood supplies are damaged, head of the femur, you studied that, right? You had the bones test. There's a little hole in there called the fovea capitis femoris. Ringing a bell? Maybe not. Okay, that's where the main blood supply comes into the head. It's a ligament that's got the blood supply in it. The best two-sport athlete I've ever seen, a guy named Bo Jackson, was all-star. He wasn't just the all-star of the NFL's all-star game. He was the MVP of the baseball all-star game. Get the idea? On an innocuous hit going out of bounds playing football, they hit his hip in just the right way. It dislocated his hip, ruptured that. It's not easy to dislocate a hip. Ruptured that. Okay, his hip, the head portion of his hip, of his femur, died. It's called avascular necrosis. No blood supply. He was never the same. Couldn't play ever to that. Ended up very successful. Very bright guy. Very successful, but had to have a hip replacement early on. All from one area of blood supply. When you take away blood supply to important areas like that are under, particularly with a lot of cartilage. Cartilage dies pretty easily, and the head of the bone died as well. So voila, now you're starting to get a better look at the thickness. Here are those Sharpey's fibers, what they call them, perforating fibers. Blood supply comes in, and each one of these little openings there, okay, are part of this neat system called the osteon that we're going to come to very short. They're like, imagine little tiny tree trunks because constantly around them are layers and layers of bone, sort of arranged tree trunk-like, for lack of a better way to express it. There's like tiny pillars. It's like if you went anywhere, the hobby store, to Home Depot, to Lowe's, and you got dowels, little circular pieces of wood. If you have one of them, they kind of nice and flexible. Take 4, 5, 10 of them together, tape them together, much stronger. That's what your body does. So they're weight-bearing pillars that you will see. It's miraculous. And so much so that they can twist a little bit, tiny bonds holding them together, like the tape, tear and break a little bit. And then it's like you step in and twist your ankle and you go, boy, that was a pretty bad twist. I wonder if I broke my ankle. Didn't. That's because they're forgiving. They're called sacrificial bonds. They'll break and reset as opposed to letting the bone break. And to be honest with you, from a clinician standpoint, bad sprains are sometimes harder to treat than simple fractures. I'd rather the bone, because by no bone will heal. Like bad sprains, those high ankle sprains, totally different animal. We talk about that in joints, a little bit different. Yeah, I did about 25 years worth of maybe 20% of my practice was sports medicine. My kids were all lived on the ice, were all figure skaters and hockey players. Drive you nuts. I will never go to another ice rink. So here, red marrow is found in those trapecular cavities. Diploe is a famous name for that. I was showing you before. That's that spongy bone inside the skull bones. It's sort of unique. Okay, and you can read through this. Yellow marrow can convert to red if the person becomes anemic. Yeah. Where they find bone marrow these days, if you need them for a bone marrow transplant or to do to assess whether your bone marrow could be coming into you, or it's typically the sternum or the iliac crest. Remember the iliac bones, the top portion of your hip bone, because easy access. You just have to go through skin and soft tissue, and you can sort of take a hole puncher, suck out marrow to analyze it. That's how when you get the blood unit, that's how you figure out if someone's anemic. And you did all this. Bone markings, no, we're not doing it. You'd be happy never to see that again. It's important for you folks going into clinical fields for surface anatomy. You're going to learn, if you're in nursing, you're going to learn about giving injections. They do it with triangles based on those bony prominences you can palpate. So all about that notch here. That's where you can trach somebody because it's dead center. I mean, you've got carotid arteries and jugular veins. You don't want to nick one of those. Someone's going to die. You get the idea when I'm telling you this stuff? It's all the surface anatomy helps you. So these are the different kinds of cells that you're going to find there. Progenitor can be anything. These are all the same cells. Fibroblasts, they come from mesenchymal tissue. They're all basically the parent cell. When you're making a fibrous part of the skeleton, they're fibroblasts. They can change when we need to make cartilage into chondroblasts. Bone heals like this. Same cell, it can just change. Magic. We understand why and how? Don't know. Okay. Osteo, when it says blast, osteo, making bone, blast means it's busy. And it's having the opportunity to make ground substance, collagen fibers. It's all collagen fibers. And together they become the matrix. And interestingly, those collagen fibers, the ground substance has something called calcium binding proteins. It tracks calcium salts to it. And it comes in this very unique pattern that you will see ever so shortly. When they are done, it's not like they've stopped functioning. When they're no longer active in the blast phase, they become osteocytes. Sites means that they're active. They're sensing the little pressures and tension, getting chemical signals from one another. Decide, we have to convert temporarily to blast form to reinforce this area because there's weight being borne here or activity here. Oh, calm down, and we're going to let the remodeling cells remodel because we're not using this quite as much. Just like if you have someone who's a patient and they're stuck in bed for months. That's why we try to get people up fairly quickly. Their bone will start to thin. It'll start to undergo a process called atrophy. without growth. And at that point, it will thin, almost become osteoporotic. For young folks, it's like being in a cast. You take that, young people in a cast, everything will look like it's shrunken. Give them about 2 weeks, it all comes back because of your recuperative powers. That's why we use more those sort of removable casts, because you can do wound care, you can do rehabilitation and still immobilize for weight bearing or getting around. Like we see them on campus all the time. It's very, very modern. We either put people in plaster casts or in fiberglass casts all the time. So, and the bone lining cells is unclear. The osteoclast is not in this line. The osteoclasts are specialized white blood cells. They're kind of macrophages, those big eater cells. Basically, they come in clusters of it's multicellular. They have a thing called ruffled borders, and they're the ones that basically are doing the major remodeling, in the sense they're not producing bone, but they're gobbling it up. If you need calcium, you get busy, dissolve some of the bone, out comes the calcium. Your bone's nothing but a big bank for calcium. Yeah, unfortunately, it's not like my bank, which only goes in the wrong direction. In this way, I tell you, don't have children or grandchildren. So osteogenic cells, stem cells, fine, happy dance. Osteoplasts, the unmineralized bone matrix called osteoid, fancy name. Collagen and calcium binding proteins. Collagen, 90% of the bone protein. That's why we have so much collagen everywhere in our bodies. They're very active. They have some pictures that are there. So they really don't see a lot to them. What happens and this idea, and I'll give it to you in a second, about this idea of a lacuna, it's really something, it's just an area that doesn't stain. It's as though it appears that the cell is in a hollow area. It's not empty. You see, a lot of these are things that they call these lacunae, these little chambers that appear to surround cartilaginous cells called chondrocytes and osteocytes. This probably have to do with whatever is in there. There's not a lot of empty spaces, but the material doesn't stain or doesn't stain distinctly, and therefore it appeals like a house. It's not like they got their, it's got a little house of its own. But it's, for students to learn, it's not a bad idea. They respond to mechanical stimuli. Everything in bone is about something called Wolff's Law. Wolff's Law means bone responds to pressures that are on. You'll see the name later. And so, for instance, if you're unfortunately maybe a terrible accident, you're paralyzed, you're wheelchair bound, everything's going to change because you can't get up and use, let's say you're paraplegic, you can't use your lower extremity. The bones are going to adapt to that new position. If someone has a stroke and they can't do that, eventually the bones are going to adapt here, the joints are going to adapt. Someone with arthritis, they do all the time. All of a sudden, the cartilage that should have been facing forward gets cockeyed. It just does. And that's what I did a lot, was to correct those things that are there. So the osteocytes respond to those sensors, okay? And they have a unique way of communicating with one another. It involves some of those gap junctions. There's a familiar word, okay? Those gap junctions that send either chemical or electrical signals to one another. So they work as a unit rather than being, they're not independent, they're networked together. The bone lining cells, whatever they do. And the osteoclasts, macrophages, we call them giant cells because it's really a multicellular unit would be the best way to describe that. A multinucleate means there's just a whole bunch of them and they've sort of fused into one. And they're called resorption bays. They have a ruffled border. That's all about surface area. And they secrete enzymes that degrade the bone. Depending on where you're going, with my advanced class, when we just did bone physiology, they learn about the particular enzymes, and it's done in an acidic environment. And so some of the things we look for in some of the chemical tests that we do. In lab tests, as you see what's abnormal, you'll see things like alkaline phosphatase and acid phosphatase. That's some of the tests, which you don't have to know here. They're like this, these little tentacle-like projections It's the same kind of a cell. These didn't magically form, but as the matrix hardened around them, these little projections were maintained, but the matrix is around them, holding it. And so what happens is it's almost like little arms or little feet, and they can communicate with each other. It's like I'll wiggle my finger, and a signal will go to the next cell going, yeah, get busy, or slow down. Now I remember. And this is the osteoclast, multiple white blood cells fusing together in a sort of a unique fashion. Here's the ruffled border that's there. Clasis means destruction. So clast means destroy. You crush something or crunch something. And I don't get a lot out of that picture. This is neat. This is the microscopic anatomy of bone. It's so interesting. Okay, the main functional piece to understand why bone is so strong and unique and has this remarkable ability to heal, and it's specifically, it's everywhere in bone along the rims, but really abundant in the long bones. It's called the osteon. People have different ways of pronouncing this next name. I was told Haversian. Some people say Haversham. It's okay. It doesn't matter. Okay. So, and they have canals and canaliculi, which is a canal and a little canal. And they have different kinds, layered bone, and that's where the term lamella means a layer. And I'll go into all of these types of things. So the osteon is this unit. Again, these are the tiny pillars, an elongated cylinder. You want to take a bunch of pencils and stick them together like that? That'll work. Same deal. Make a mega pencil. Tiny weight-bearing pillars, good description. Rings of bone, and those rings are effectively layers of bone. So they contain collagen fibers, you're going to see this in a second, that go in different directions. And because of this, they have not just the capacity to resist being pressed on, but being twisted from side to side, stress and twisting. And in between all of those fibers are those calcium salts that you're going to learn about. Have a fancy name called hydroxyapatite crystals. It's in here. It's on the test. Typically made of calcium phosphate, maybe some calcium carbonate, magnesium phosphate, but calcium phosphate predominates. Also on the test. That's why we listen to these recordings. Listen to this thing. It's like one of the best illustrations anywhere. They lay down the fibers concentrically. You want whichever way you want to call this. Counterclockwise, clockwise, doesn't matter. But each layer goes in a different direction. Imagine how much force we have. I mean, we have biomedical engineers in all these classes. When you look at something like this, you're trying to mimic the engineering of the body. That's what they do. Find materials that can do that. We'll be able to make materials in that fashion. That's kind of where it comes from. That's a whole subscience. A lot of my colleagues went into this. One of my friends who became, he was he's a surgical director in a medical school. I mean, he went to Switzerland where they learned all about all these advanced things that you would use for implants and for all the interesting plates and pins and screws and devices they do when they have to significantly heal fractures. So much skiing that goes on. That's where they get a lot of that from. So material science, very important. Here we are. So now you're going to see it in a second. Central canal, blood supply going perpendicular to, beg your pardon, along the long axis, parallel to the long axis. Think up and down, and you have blood supply going in toward the center part of the bone. So you have blood supply, long axis of the bone, blood supply perpendicular to the long axis of the bone, and the cells communicate around the periphery. So the central canal, main blood vessel, main nerve supply. Down the road, you'll hear a lot of talk about what's called a neurovascular bundle. Healing is a part of two things, nerve supply and blood supply. If you have good blood supply, things heal. If you have bad nerve supply, it impacts it adversely. Why diabetics have trouble healing? A lot of times they have bad blood supply, but a lot of times the nerve supply doesn't allow the blood to be delivered there appropriately. We'll talk about it. You'll learn a lot about that. Most of you will. So perforating or Volkmann's canals are the ones that run tangentially, perpendicular to the long axis, but pointing into the central canal, into the middle. You'll see that. Again, more stuff that's there. The little cavities, or lacunae, just like they are in cartilage. These tiny canals, and they look like little hairs. They're really just seeing those cytoplasmic projections of the osteocytes going around like this. Like they're all holding hands, and oh God, that was I just got a terrible memory. It's like when we were in third grade, it was like mandatory. They had to teach all the kids. This is a considerable amount of time ago, ladies and gentlemen. We're talking like 1960, how to square dance. Did you have to do that? Thank God. And you're running around holding insert. Honest to goodness. Very few places to square dance when you grow up 20 minutes from New York City. It's just not. It's just not a culture. Where that came from, I will never. And so the matrix hardened, the cells are trapped. If you want to buy that, buy that. Okay. The canaliculi form, you have the little projections, voila. And these are the ones, this is the glue. So if you're holding up a bunch of things like this, okay, circumferential glues them all around this way. Interstitial is little glue in between each unit. That's where a lot of those sacrificial bonds are. They help the long bone to resist twisting. That's there. And so you see all of it. Very good illustration. Okay. Here you can see these concentric things. This is that central canal, main blood supply. You can see all of them that are there. Okay. These are the Volkmann's or perforating canals. They're running at right angles toward the interior with the cancellous bone, all those neat little plates that are there. That's a very good micrograph to show you what's contained in there. This is a classic view that you see here. The canaliculi there, like that's a lacuna and that's a lacuna, and you just see like tiny little threads. But you can imagine they're the ones that are going. The cells are here, here, and here. Better illustration schematically to see that, and they're interconnected. And that's what it looks like. So out here, you have the circumferential lamella sort of holding all those pillars in place, and in between them, the interstitial ones. That's this elegant design. This is all cortical or compact bone. Is there. So the spongy bone, it's all about, we look at these. We come back, when we'll look at, and I'll be projecting a few x-rays. We do a whole unit on fractures. I love to teach. And these all form not randomly, but according to stressors. I mean, I'm in a classroom with a lot of people who do sports. I have students all the time with stress fractures. We look at the projections of where those trabeculi form. They're like reinforcing, they're underpinnings. And when if they begin to thicken in a certain area, that becomes a quote stress point. And down there, you start looking at that right away and say, you have to turn training or whatever to try to avoid that, to keep the athlete being able to basically perform for the duration of whatever their sporting year is. So again, it's actually organized along stress lines. They're called trabeculi. It's an important word. Cables of suspension bridge, good analogy like that. I don't know anything about the mechanics of that. That's out above my pay grade. No osteons, regular little pieces of bone, and osteocytes, doesn't matter. And again, that same illustration, but it gives you an idea. I call it a honeycomb. Again, it's all about surface area. That's there. Here's the organic components without the calcium and magnesium salts are called osteoid. Okay? They can, soft stretching and things like the hard ones, mineral salts, resist compression. So they both have a role. This is very telling. Think bone. When two components are in the right proportions, normal healthy bone. Bone is half as strong as steel, resisting comparable piece of steel and a comparable piece of bone. And I mean, that bone, when you get half the pressure to crush the steel, the bone's still intact. How's that? I mean, you jump out of something or you're doing an activity. How much compression, and as strong as steel, resisting tension, twisting, turning, bending. The design is miraculous. Keep up the good work. You gotta let the design department, they're doing a good job. So the organic components, everything, okay, all of that is called osteoid, 1/3 of the bone, okay, all that stuff that's there. Here are the sacrificial bonds in between collagens that stretch and break, dissipating energy, and then they'll reform. Inorganic, hydroxyapatite, 65% of the weight of bones. And when we get to osteoporosis, the mistake people make is, oh, you're losing calcium. No, it's bone substance. It's just the way we identify it radiographically. It appears to be only the calcium. It's not true. That is a significant mistake. That is a significant teaching point to understand. It's that you're going to have so many people, if you're taking care of or clinically interacting with population, it becomes a real player, and early. Tiny calcium phosphate crystals around the collagen, hardness, resistant. We know it's long after death, skeletal remains. Did you go into that with some of the skeleton, like the hip, being able to determine with the gender, male or female? Yeah, that's absolutely very, very informative. Very important. We can also age it, because if we see it, we could have a large child or a small adult, and you look at it to see if the growth plates are still present. So there's a lot of forensic basis for this. Very, very interesting. Because sometimes all you get is skeletal remains. You have one of these cold cases that they're trying to look at. And maybe you can still extract, depending on the condition of the remains, once they're a certain DNA for profiling, you can age. You do all sorts of stuff very, very progressively. Very interesting field I'd love to know more about, but I don't. I'm sure you found that very enjoyable and informative. Okay, so that's kind of where I'm. In the sake of convenience, let me just do one more thing, just to sort of set up the stage, because I didn't think I'd get through it quite so rapidly. And I sent you this one also. So this is the bone develop. We have like 3 more things in this chapter. So we have in this B PowerPoint. This is the development. This is when we look at how it forms. I'm not going to spend a lot of time with that comparatively there, all that stuff. But I am going to spend some time in allowing you to, how it grows and what goes on. So looking at this to get an idea, that's an area of a growth plate. So we need that particular nugget. We need the hormonal controls. We'll begin to look at parathyroid hormone and calcium and vitamin D playing a role, and some other important hormones and some of the remodeling that's there. And then we do the fracture number, and then we do osteoporosis number. So there's 4 more things to go over. There's really not a ton in the chapter. There's a ton of information from those 4 areas. All right, that's where we'll stop. Thank you. Again, starting Wednesday, and I'll let you know Wednesday morning if everybody's taking it. I've already had a couple of students make some appointments. Unfortunately for you, I do not have any more planned absences for the time being.